Hello everyone, I am Sneha, lecturer, Department of Vision Assistant, SNS College of Allied Science. Today we are going to see about cleft lip. Introduction. Cleft lip is a congenital defect involving incomplete fusion of the upper lip. Usually it is a by birth defect creating a gap or split in the upper lip, which is shown in the image, often extending to nostril. It may exist alone or it may exist with the combination of cleft palate. Types. Cleft lips are classified based on laterality and completeness. Based on the laterality, how it extends from the lip to nostril or nose. It is divided into two, unilateral type and bilateral type. In unilateral type, it affecting the one side of the lip, and also it is more commonly in the left side. Here is the image of unilateral cleft lip as well as bilateral cleft lip. In bilateral cleft lip, it affecting the both. Based on the laterality, it is divided into two. Next is based on the extent, how it extends from the lip to other structures. First type is incomplete, a gap that does not extend through the entire lip into the nasal floor. So it is not extending entire lip, so it is called incomplete. In complete type, a total separation of lip extended into floor of the nose. If it reaches floor of the nose and also entire total separation in the lip, means it is complete type. Next is with cleft palate, can occur with or without split in the roof of the mouth. So it is called with cleft palate. Pathogenesis, how this disease occurs. Cleft lip result from the failure of medial nasal processes and maxillary prominences to fuse between 4th to 7th week of gestation. In mother uterus, in 4th week and 7th week of gestation, the process of medial nasal and maxillary prominence will fuse in that particular week of gestation, interrupting the normal joining of tissues and leaving a gap affecting the skin, muscle and mucous membrane of upper limb. In mother's uterus, the baby will have defect in normal fusioning of the tissues, so it can result as split in the upper lip, resulting in complete or incomplete clefts, which is shown in the image. It is the frontonasal process and also frontonasal abnormality image, which will create a split in the palate as well as lip. If it is affecting the palate, means it is cleft palate. If it is affecting the lip, means cleft lip. There is a split in palate or lip. In this cleft lip, it will affect the lip of the baby. So it can occur in one side or both sides. Causes. Genetic factors, genes such as IRF6, MSX1 and PVRL1 have been identified. Variants in these genes may cause a cleft lip. Environmental factors, maternal smoking, alcohol consumption during pregnancy and nutritional deficiencies during pregnancy may result in cleft palate. Tetragenic exposure, medications like phenytoin, retinoic acid and corticosteroids will give side effects such as abnormal fusion of upper limb muscles. Epidemiology, this incidence approximately 1 in 700 to 1000 live births globally. Demographics, more common in males comparing to females. Laterality, unilateral clefts are more common than the bilateral. One-sided split is more common with the 2:1 prominence on the left side. Clinical presentation, visible lip gap at birth, which is shown in the image. Left unilateral is most common. The image is left unilateral cleft palate lip. Nasal deformity also present because it will affect in the nasal floor muscles, so nasal deformity will also occur. Possible alveolar involvement and also feeding issues. Due to this split, baby can't able to suck the nipples and having normal feeding. Otitis media, our ear, nose, larynx is also interconnected through eustachian tube. A split in the nasal floor muscle and also lip may easily involve the microorganisms to the ears, so it will affect the inner ear, which leads to otitis media, affecting the middle ear. Next is prolonged inflammation in the middle ear, such as otitis media, leads to hearing loss due to prolonged inflammation. Speech delays may occur because of the split in the lip. Investigation to diagnose this condition, in prenatal, ultrasound will performed at 18 to 20 weeks, and also 3D imaging. It will show the cleft lip or palate. Postnatal, after the birth, clinical photography, nasal endoscopy, genetic testing, audiology will perform to the newborn baby. Access for syndromes and middle ear infection. We have to diagnose the particular cause for this condition, then we will do the management accordingly. Management, primary lip repair performed at 3 to 6 months of age, often following rule of 10. The baby should be 10 weeks old, 10 pounds and 10 gram by deciliter of hemoglobin. This is the rules of tens. After this only the surgeon will perform the surgeon. Usually it is performed at the age of 3 to 6 months. Unilateral cleft lip repair. For this cleft lip, the surgeon will perform Millard rotation advancement, rotating the flap, and will fuse the sides of the lip. Next is tension randall, triangular flap. Use a precise geometric approach, triangular flap from the cleft lip into the non-cleft side. Here is the images of rotation advancement, inferior triangle, and also unilateral cleft lip repair treatment. Usually in triangular flap, surgeon will mark a triangular incision and will fuse the lip. Before surgery and after surgery images attached in this slide. After surgery, surgeon will fuse the split and baby will have normal lip after the surgery. Next is Fisher anatomic subunit repair. A new approach, specifically natural boundaries, is more effectively comparing to others. Bilateral lip, cleft lip repair, straight line repair, and also Millard single stage repair. Here is the image of Millard rotation advancement. Surgeon will rotate the flap